Let's now talk about the healthcare sector because we are all recovering from coronavirus pandemic, and our discussion now is going to be on reimagining healthcare in India. 2020 was a difficult year for the entire world. For India specifically, it turned out to be an eye opener, and that's what we are going to be discussing now. Joining us today is Shishir Kumar, who is Director Healthcare and Life Sciences, Hitachi Vantara India Private Limited. We are also joined by Dr. Sanjeev Bagai, who is MD and Chairman Nephron Clinic. We're also joined by Mr. K. Madan Gopal, who is Senior Consultant Health with Niti Aayog. And we also are joined by Mr. Vaibhav Tiwari, who is the Chief Operating Officer of Portia Medical. Mr. Tiwari is the co-founder and member of board there as well. Thank you very much, all of you, for joining us for this panel discussion. Uh, Let me just set the context here, and I will like to recite something in Sanskrit. Arogyam param bhagyam, swasthyam sarvarth sadhanam. In this old Sanskrit saying, in fact, lies perhaps the reality of modern India. Like clean air, clean water, in fact, healthy food or good health is a matter of param bhagya. And that is something we got to know, especially when coronavirus came into our lives, that how the most pampered cities in the country that we have today, which talk about good medical conditions, flyovers, metros, and everything, actually failed all of us when the real test came of coronavirus pandemic. And this has exposed the reality of healthcare sector in our country. And that's why today we are going to be talking about this idea of reimagining healthcare and how technology can play a very crucial role. Let me begin this discussion with you, Dr. Bagai. In your assessment, how much did coronavirus pandemic really expose the reality of India's medical system, India's healthcare?
Uh, Good day to everyone. I think the entire phase of last year and the early part of this year, inclusive, has been a frontal attack on humanity. And in spite of all the deficiencies and the need gaps and the shortage of doctors and skilled staff, I think India has done remarkably well as compared to most of the Western globe. What the world has proven to itself and to everyone else is that we are extremely poor in managing crisis situation. The big leaders of the world healthcare have almost contributed more. Single country like America has contributed to more than 27% of the total number of COVIDs and more than 21% of the total COVID deaths, in spite of having just 4% of the population. But coming back to COVID and post-COVID era, as far as India is concerned, we were caught napping because we didn't have an entire concept as a nation of PPE kits and the protective gears and the N95 masks and the sanitizers. And within a year, we've become production surplus and we are exporting it. We were caught napping with regards to the ventilator needs, although science then proved that ventilators were not a good thing as far as decreasing mortality is concerned. We were pioneers not only in medications and production of various pharmaceuticals, but also one amongst the only four countries to produce the vaccine for COVID. So I think India is a pioneer in healthcare. But what are the learning lessons out of COVID going forward? I think there is a disparity in terms of a non-equality in terms of the geopolitical distribution of healthcare in various states. The population to the last mile, the lower end of the pyramid, is still lacking. We are about 10 lakh, that is 1 million short of doctors, and we are approximately 1.2 million short of nursing staff. If India builds 200 hospitals every year of 200 beds each for the next 20 years, we would then cover the past deficit of the beds required. Digital technology, smart care is the only way forward. That's the only way, not only to move away from what we call as the big three A's. Just allow me 30 seconds of what we call as affordable, accredited, and accessible healthcare. We have to move to the big P's. What are the big P's? Personal healthcare, primary healthcare, preventive healthcare, precision healthcare, proactive and predictive healthcare. Unless until the care is not reaching every person in India, we are not safe. So no one is safe till everyone is safe. Like to say, the strongest part of the chain is the weakest link. So we have to look after everyone now for us ourselves to keep safe.
Absolutely. Three A's earlier. Now the focus has to be five P's. And the weakest link is something that India really needs to look after. And that's the need of the hour. Dr. Bagai, stay with us. Mr. Madan Gopal, now I was going through some data as far as the weakest link is concerned that needs the most, amount of attention right now. A UN report has suggested that 75% of the healthcare infra in India is actually concentrated in urban areas, where only 27% of the Indian population lives. So far, we have always neglected the rural part of the country. And when COVID came into our lives, it was not so bad in the rural part of the country, actually, but the urban, part of the country, which showed us that how even the infrastructure there was not sufficient. How do you see the situation?
Thank you, Hina. So one of the myths which we all have is that the healthcare 75% is in urban areas. We should understand the health system. Over the years, it has evolved. So it has been predominantly focused providing the rural health services in the form of primary health care. As a result, you are having a system which has evolved right up to 3,000, 5,000 population. We are having a network of surveillance centers. Above them is the primary health centers, then the community health centers, and the district hospitals and the medical college. That's a structure it has evolved over the years. Having said this, another thing is we should look at the GDP expenditure on health. The private sector expenditure dominates it. That is three-fourths, around 75% expenses happens in the private sector, that too in the form of diagnostics and the medicines and the other things. As a result, the government is having schemes to address these issues also. In this COVID pandemic, COVID has been the pandemic has been an urban phenomena across the globe. It has been an urban phenomena, and it is more or less related to the density of population. Wherever the population is dense, the spread of the virus has been fast, and you are witnessing that in the densely populated area now the infection is coming down because the spread has happened and it is coming down. That phenomena is there. When the infection came, whole of the world was not knowing what to do. So we have just revisit the time-tested old methods, and we found that the old methods which have been used during the early 90s, they have stood the test of times. The lockdown measures and the other tests. Because if you are not having any cure, if you don't know how the virus is spreading, what would be the consequences of that, what you will do? Because you have to rely on the tested methods. That means you have rightly mentioned that reimagining healthcare. We are not reimagining, we are revisiting the methods which have been used effectively, and we are using technology to create the already existing, already time-tested methods. And that has been deployed beautifully during this pandemic. And it has been the mix of technology, the mix of the old methods, all the things they have resulted in the results which we are seeing now. Okay, that kind of progression has happened. As one of the important thing in any pandemic is prevention of mortality and prevention of a catastrophe due to that illness. One of the targets of any mortality, any epidemic is reduction in the number of deaths. And we have been fairly able to maintain that level as compared to the rest of the globe, rest of the countries. India is performing quite better in the death. It shows the quality of treatment.
Well,
Quality
absolutely.
of
That is
other
something that we've seen in
protocols
the
which have been
numbers
followed.
as well. Yes, that we've seen in the numbers as well, sir. How
Yes.
our fatality rate was among the
And
lowest in the world, and of course, how India did manage to improve its healthcare infrastructure, especially during the lockdown period. The kind of measures that Dr. Bagai mentioned also are very, very important. How India did perform, when the time actually came. Mr. Vaibhav Tiwari, I want to ask you, what is it that can make for the private sector the rural part of the country an attractive proposition? I mean, because a lot of private investment that we see as far as the healthcare sector is concerned is largely in the urban areas only. What can be done for the private sector to go to the rural part of the country as well, because that is where the potential is now, isn't it?
Yes, you're absolutely right. I think what has happened, and as we are discussing the COVID scenario, I think what has happened during COVID times with governments as well as the private sector and consumers and patients in general, the usage of technology to solve the healthcare problems has been proven beyond any doubt, actually. So before that, there's always this discussion that whether consumers or patients are basically happy taking a consultation, teleconsultation, or doctors are willing to do that as much as they would like to do. But during COVID times, we saw, given that people were in lockdown, could not move around, there were tremendous opportunities got created for using teleconsultation, for using technology in a very, very exhaustive manner and comprehensive manner to deliver healthcare. I'll give an example. We ourselves worked with 7 different state governments to manage patients under home isolation. And the whole program
Okay.
was created in a completely remote management model. So we worked with, in fact, 7 different state governments and managed over 3 lakh patients in home isolation during the whole COVID time. And the whole solution is totally remote, of course, in consultation and in association along with government, because the local agencies were basically helping us to take patients to the hospital wherever the situation was worsening. But almost 97-98% of the patients could be managed well under home isolation using
Hmm.
teleconsultation, using healthcare workers talking to them regularly, and using technology in a very effective way. So that's
Hmm.
something I think which is a very, very big positive for us now. And if India has to take the healthcare to the tier 3, tier 4 cities and basically take to rural areas, I think last mile connectivity becomes very important, and technology
Hmm.
plays a very important role in that. So, and technology, and of course home care, what we have been doing. So from those two angles, if we can reach out to the patients in a technology led manner, so you could probably
Hmm.
connect a tier 3, tier 4 city, people over there with a central network of doctors, specialists, healthcare workers, and a
Hmm.
combination of people on the ground and people, of course, centrally available who can support the patient, can
Hmm.
really scale the healthcare infrastructure in a very, very big way. And of course, the
So,
National Digital Health Mission is talking
hmm.
about that in a big way. If we can have all the patient data together, which is I think is the big plan, and
Hmm.
you have the patient data portability, and of course you could reach out to the patients using digital media and using technology. I think the
Correct.
scale could be very, very humongous. In next 8 to 10 years, we could see our healthcare systems becoming a lot more prevalent, actually. So even if you
Okay,
see in
so
India
to reach
otherwise,
out, yes, sir. So to reach out to the bottom, those at the bottom of the pyramid, of course, technology has played an important role and it has got great potential as well. Mr. Shishir Kumar, can you give us some kind of examples as to how Hitachi tried to, help India, especially the healthcare sector, ever since coronavirus came into our lives, or otherwise, the kind of efforts or collaborations that you have with the government in the healthcare specifically?
So, thank you. I think most of, I think very relevant pointer, and actually to point it out, actually when I would like to begin with this with a saying, it is said that there's a famous thing saying that a few grams of dead protein can't rule humanity for long, and that's being witnessed with what Dr. Bagai was telling and what Dr. Madan Gopal iterated, that how we have managed the pandemic. Now, looking at this is a very rare moment, where the technology, the policy, and the urgency to change and to change is converging with the government, public sector, and the private sector. One of the ways to actually effectively manage and to actually bring about this convergence is to innovate and do the last mile connectivity with the patients. Now, how do you do that? When if you have to do that, you have to actually make sure that the digital health infrastructure, the health infrastructure and the solutions are well connected with an empowered citizen. Now, if you look
Hmm.
at it, there are institutions which have managed this well. There are institutions which have not managed it well. However, in this landscape, the technology infusion, along with expanded infrastructure and efficiencies, will actually improve the process and outcomes. And this has been demonstrated by different measures that the government has taken. Hitachi
Hmm.
or any private sector, uh, will have to actually make sure that bringing in right e-governance along with the layered approach to bring in solutions which are not electronic medical record, but electronic health record, population health management. That's the way to future. And if you look at it in future, India will witness a complete spectrum of change of healthcare, and which is what I can see Niti Aayog and Ministry of Health working together, whereby the small clinics, it's going to be a complete spectrum of ecosystem whereby small clinics will coexist with home healthcare, large sophisticated hospitals working in collaboration. So the model of collaborative care will be very different, and this will be
Hmm.
driven by citizen empowerment, by use of technologies. Now Hitachi in the country, with all its historical, we have been deploying multiple sets of technology, right from diagnostic technologies, imaging, and the high-end proton beam therapy in the country. Having
Hmm.
said that, we have health e-governance platforms, which actually are like hospital information system, population health records, telehealth offerings, which actually connect the patients. And this has been deployed for more than 12,000 beds across states, etc., in the country. Well, when you look
Hmm.
at these initiatives, what is really important is the patient at the groundmost level should know that I can leverage this technology. I need to know
Hmm.
how do you move forward with that. And hence, the trend is pointing towards more and more in terms of knowing your own self, the preventative curative. So
Hmm.
when you have to move in that direction, the empowerment is very important. The citizen should know, okay, this is what I need to manage myself in the preventative approach, whereby IoT or the med devices will play a lot of change for home monitoring with a physical and remote
Right.
intervention. Now that can be only laid by telehealth platforms and connecting by making sure that the clinical protocols and operating protocols are in tune, and only then you can actually move forward for the health outcomes. So this
Hmm.
will emerge with your IoTs, your
Hmm.
electronic health records, and some of the physician assisted AI. It's not AI will
Hmm.
not replace, it will assist
Okay.
caregivers and health workers to transform the diagnosis and treatment at the ground level. So that's
Hmm.
what we
We'll talk
see as
about
happening.
AI.
And we are, you know,
Okay, we'll talk about AI, I think, in detail as well a little later. But after the opening comments, I want to also ask our viewers as well to participate in this particular discussion. Of course, you can do it with by responding to the question that I'm going to ask now, which will be appearing on your screen. The first question that I want to ask you is that: are you happy with the budget booster dose that has been given by the finance minister? You have two options: yes or no, because that has also shown us, in a way, the intent of the government and its vision for the healthcare sector. Dr. Bagai, I want to ask you, there were so many recommendations in the past that the government should increase spending in the healthcare sector. Now, with budget 2021, talking about 2.23 plus a lakh crore in the healthcare sector, do you think it shows the seriousness of the government and this has the potential to completely revamp the healthcare sector?
I couldn't agree more. I think this budget, which has been announced by the present government, I won't go into the statistics of its 137% increase as compared to last year's budget, but has been
Hmm.
completely really transformational. Healthcare effects, as far as benefits are concerned, very often you don't see immediately within a day or 2 days. But this is something which is a huge, giant step for Indian mankind, the benefits of which we will be reaping for many decades. So, when you talk
Hmm.
in terms of what we need to do now, focusing on
Hmm.
aspects on the ground, any technology which gives you five endpoints: one, it gives you clinical excellence; two, it gives you operational excellence; three, it gives you a better patient experience, because patient is not a peripheral event in the healthcare. A patient is the center, core center. When we talk in terms of patient centricity, the patient is the decision maker in the cycle of a caregiver's life. So, a better patient experience, better doctors and nursing staff operability within the institutions, and last, more important, is data analytics, and therefore the clinical research which comes and flows out of it. So if any technology can give you these kind of endpoints, 5 endpoints, this technology just has to work. To mention two classical and very easy things for everyone to understand: a person who's staying hundreds of miles away can reach out to a hospital through digital technology, can be mapped, can be monitored through sensors to devices, not only e-consultation or a video consultation, through a command center, and you can save lives primarily because you can pick up a diagnosis much early. You can institute even home care early. You can institute an emergency care being instituted for that person to be reached. Next, most importantly, is healthcare is the largest employer of any industry, any manufacturing unit in India. It has the largest base of healthcare workers, staffs, non-clinical staff, and even cleaners, sanitary workers, and so on. What we now
Absolutely.
need to do is to create healthcare cities. So a classical example is, which I visited very often and I've learned from it, is University of Pittsburgh, what we call as UPMC. About 40, 50 years back, after the Great Depression, that complete town was devastated. The good people, the sensible people got together and said that was the glass and steel capital of the world. It produced more than 50% of the glass and steel globally. And once the industries crashed, they realized what's the only way forward? Two things: health and education. Today, that center has, one small town has 29 leading hospitals and universities of the world, just one town.
Okay.
And it has the largest flow of tertiary and quaternary care patients. What we need to do is to decentralize, take patient care out of the major metros, not only in tier 2, tier 3, pick up the remotest place. You need to build the first stone, and you will see the full town evolving in terms of economy. I'm entirely convinced that India is in the first maybe 5 or 10 of the world right now. 10 years from now, India will be number one. I have no doubt, no reason to disbelieve that.
Okay, so you have confidence on India's capability. Let me
Surely
ask
do.
Mr. Shishir Kumar, in fact, the kind of objectives that Dr. Bagai was talking about, is there anything that Hitachi can offer in terms of a solution, through the use of technology to address these concerns, to fulfill these objectives?
So, I think it's what I kind of concur with Dr. Bagai, because one, I think when you look at the current Indian healthcare scenario and the Make in India initiatives that has been launched, with, if you look at the strides that are being made in health insurance platforms like PMJ schemes and Atmanirbhar Bharat mission, the current announcement of the the Swasth Bharat Yojana is one of the key things. And with these kind of initiatives, where we are setting up multiple 9 virology centers, aims in each of these states, IITs, etc. What I see is that the education is being managed. However, having said that, one of the things that will become very, very key to manage the health and infrastructure is you need to making sure that the med devices are available in India, which is make in India and then to the world. So with that kind of strides, I do not see why we can't make it happen, and it is already being happened. I think the PP kits, the health tech devices in terms of managing remote care, etc., are there's a cataclysmic shift which is happening right now. Now, having said that, looking at it from a perspective of how patients will react and how it has to be reached to the patients, I think Dr. Bagay rightly pointed out with my colleague Dr. Madan Gopal that to the last mile connectivity and care protocols being driven by clinical excellence has to be shielded by the health tech, and that technology that we make in terms of, it's just not a mere record or a mobile health app. I think it's going to be a unified platform which will converge the care models, the institutions, the infrastructure, and the citizens. So when we look at these kind of initiatives, we actually are working very closely with multiple state governments, bringing in and building what Dr. Bagai said, the command centers. Few of them are already live, and operational, where we track multiple ambulance. You can statewide track ambulances, etc., where the patient is converging from one location to the other, whether it's been dropped, etc., to the last mile readout. In some of the states, we are doing large scale health telehealth pilots, which are actually shaking up and paving the gateway of remote monitoring and remote health management. And this is at
Okay.
the groundmost level, So, in a nutshell, we are moving in the right direction, and with
Hmm.
the levers of the government policies and Atmanirbhar Bharat Yojana, Swasth Bharat Yojana, we can see that
Hmm.
the digital health infrastructure being expanded and converging along with technology to this care
Hmm.
will actually be seen as one of the noted digital health transformations for the country, and actually care outlay and care outcomes. I don't see why this
Hmm.
can't happen.
Absolutely, very interesting. And before I go across to Mr. Gopal, I have to take another question for our viewers to participate in this particular panel discussion. They can also share with us their views on the issue of healthcare sector. So my next question now is, with the existing healthcare structure, will India be able to fight another pandemic like COVID-19? Of course, we do not really hope something like that to come again into our lives, because it completely, devastated a lot of the routines and completely changed the lives of people. But in case something like this happens again, will the current healthcare structure be able to withstand that? You can respond by clicking either on yes or no and share with us your views. Now, Mr. Gopal, one thing that was very significant during the coronavirus pandemic and the lockdown period was that innovation, how we saw India really seeing that as an opportunity. We never used to produce so many low cost ventilators, and suddenly when lockdown started there was a huge shortage, but now we are exporting it to other countries as well. So, as somebody who is a senior consultant health with Niti Aayog, what will you like to recommend to the government in terms of innovation? Which parts do have an opportunity right now where innovation can really play a significant role in reimagining the healthcare sector, sir?
Thanks, Ina. I think during the lockdown, it has taught a lot of lessons of self-reliance. Because having witnessed the 2009-10 epidemic, there we were dependent on the PPE kits also that was imported. This time, during the initial period, there were some issues. Now we are exporting the PPE kit. As an innovation, what the government has started the performance link initiatives for the pharma sector and the other sector, and that is showing results. Now it would be extended to the other sectors as well. That's one thing which is happening. For the
Hmm.
health sector also, having imagined that we are having only one NCDC, National Center for National uh, Disease Control Center, that is equivalent to CDC. We would be now having a regional level district disease control centers. In the Atmanirbhar Bharat, Swasth Bharat Yojana announced in the budget, this has been envisaged. Apart from that, now we are having a genome surveillance also. It would be continuing genome surveillance, so that the emerging and the re-emerging and any pandemic, because interaction of the man and the animals is going to increase. As the development happens, the interaction between the man, animals, everything, it can't be ruled out. So we have to prepare ourselves for the emerging and the re-emerging situations. And pandemics cannot be ruled out, because as the development progresses, as the economic activity starts, the travel also starts, they would be there. You can't be holding that. But we should be nevertheless prepared for all this thing. And the coming announcement, it has already factored this thing. And innovation has been one of the greatest innovation was the release of the telemedicine guidelines. During the lockdown period, we felt that they have been stuck. The people who are having morbid conditions, they are stuck because they require a lot of checkup, routine checkup, which can be managed on a telephone. Before the guidelines were released, it was illegal in the country. Even the court has passed many orders saying that you can't be doing a teleconsultation, WhatsApp consultation. That kind was not illegal. Now this opportunity was taken now, and innovation has done, and as a result what has happened, a large sector of the large sector has opened. That is teleconsultation, telehealth sector has opened. Now we are having a lot of platforms. Another innovation which has happened is the focus has shifted from health and disease towards the wellness aspect. You can't label it as another innovation, but technically speaking, or if you talk from an engineering point of view, the wellness component is now taking a prominence, because if you are well, if you are taking care of your health, then obviously you would be in a better position to overcome the adversities because of any disease which would be affecting your immune status.
And moreover, a
So
lot of
more of the
lifestyle
focus was there.
diseases.
And
Yes. Yes, sir. A lot of lifestyle
yes, the
diseases are
focus is
becoming a big
now more or
concern
less
today.
as a lifestyle diseases. That's why 3 years back we have launched this Ayushman Bharat Health and Wellness Center. Till now we have been talking about the health, we have been talking about the disease. The concept of this is an innovative concept. That the wellness concept is an innovation itself, and whole of the things will be revolving around that. So if you look at the diagnostic prophylactic diagnostics which are used, what does that say? It is a part of towards a wellness component only. And wellness is resulting in your dietary changes, your lifestyle modification, your Ayush things are also, the integration is also happening towards wellness only. That kind of innovative methods are being taken. It's not a technology, but it's a bigger than a technology, because that element has come and now the discussion is centered around the well-being of the person, the wellness company. In that way, things are moving, and please.
Yes, sir. Mr. Tiwari, now I want to ask you, the role of the private sector. Now, the government also wants to provide healthcare access to everyone, the entire country. Universal healthcare is something that the government is working towards through its various programs. In the budget as well, we saw government announcing a new scheme called as Prime Minister Atmanirbhar Swasth Bharat scheme, which is going to cover the entire country. Can you tell us a little bit about the challenges that the private sector is facing at this point in time in collaborating with public sector, with the government on these kind of schemes for healthcare sector specifically?
Yeah, so I would say that at least in last 1 year, and I was talking about our own experience, we have seen tremendous collaboration between private sector and public sector from a healthcare perspective in last 1 year. And we are also looking at a lot more opportunities. One thing which you are talking about, whole chronic disease management, people who have diabetes, hypertension, how can you manage them? How do you look at wellness as a solution for population at large? How do you look at elder care as a solution which you can offer to much larger population? Because we see from a vulnerable segment perspective, during COVID, we realized that our elderly were the most vulnerable, and we are seeing a lot of state governments looking at how they can offer these solutions to their elderly, to their population at large. And in fact, we ourselves are in process of collaborating with quite a few state governments, where there's tremendous urgency to look at basically taking care of the wellness of their citizens, taking care of preventive health for their citizens, taking care of the chronic disease management, as well as elder care. I'll give an example. One of the programs which we are working on with one state government is saying that all their elderly in each of the blocks and districts, can we create the health officers in each of those areas? And of course, we can look at the current healthcare workers and people who are there already in the government system, how we can train them, how we can upskill them, how we can make them the health manager, quote unquote, for the elderly population in those areas and those zones. So we are seeing programs like that. We are seeing programs where can we look at creating health entrepreneurs in the rural areas, in the tier 1, tier 2 cities, and those kind of zones. So that's again something which is looking quite good, and we're seeing how we can build that. So I would say there's a tremendous opportunity in terms of what is possible in terms of collaboration between private sector and public sector. And we are seeing a lot of interest and proactive approach from many state governments to work out those plans. And we believe that it's very much possible to roll those out in probably next 6 to 9 months with various state governments. Even for COVID vaccination, we have been looking at saying that is there a way private sector can collaborate along with the government? And of course, given that we have to do 30 crores vaccination in the next few months, private sector can play a big role in that. And we are seeing a lot more openness from the government and the public sector, in leveraging the skills and the strengths which private sector brings to the table. So I would say
Okay.
that probably this little older notion that the private sector and government were not working very closely earlier. But I think where we stand now, especially in last 12 months and the way we see it going forward, I see tremendous opportunity for us to work together and create wellness as well as the health management across the country.
Okay, interesting point of view. And before I now go across to Dr. Bagai, I have one more question for our viewers as well who can participate in this discussion. Who do you trust more? Straight question, because we're discussing the role of private sector as well, and in collaboration with the public sector, the government specifically. So, who do you trust more, public hospitals or private hospitals? Because there is a clear perception that people of this country has about both of them. So you can select the option and join us in this discussion too. Now, Dr. Bagai, talking about this collaboration of the private sector with the government organizations, be it the state governments or the government at the center, where is the inhibition really? Because talking about COVID vaccine also, it's been some time already, but yet private sector is not allowed to take part in this vaccination drive. What is the challenge really, do you think?
Yeah, so let me answer it in two parts. Really, the first part, as far as your public and private is concerned, there is never a divide. Uh,
Hmm.
Almost all of us as medical professionals have been trained in the leading government medical colleges of India, and I think they're second to none. Yes, the government hospitals have been grossly overloaded, and private healthcare is little cleaner, maybe a little bit more accessible, and a lot more costly as compared to public healthcare. But the way forward is as follows: any country which has a unilateral disdistribution of healthcare as 75% private and 25% government cannot be a long-term successful solution. I think the government hospitals, one, in terms of numbers and the capability, need to be ramped up, which they are. AIMS has doubled more than twice in the last 6 years, and nothing was happening in the first 70, so to say. So I think the government hospital numbers need to go up. I think a 60-40 distribution, 45-55 distribution is a more fair distribution. Point number two
Okay.
is the private hospital must have, all private hospitals in India must have a uniformity and a graded charging scale. Any dysfunctional policy of pricing or schedule of charges at the present moment going forward can be a sheer disaster for our country. I think there needs to be a lot more transparency. There needs to be a lot more honesty. There needs to be a lot more communication with patient and a standardization pricing policy. No
Hmm.
healthcare is standard. It's not a McDonald's, right? Although we may try to be an Amazons of the world to bring healthcare into the homes, but healthcare varies because patients as a human being vary. The clinical skills of doctors vary. But having said that, doctors and not doctors, the hospitals need to be graded, not in terms of a discrimination, but in terms of facility, infrastructure, technology, bed strengths. So if you say you're doing quaternary and tertiary healthcare, you may have a slight higher pricing. But if you're doing primary and secondary, obviously your pricing should come down. Point number two is, if you have a digitalized format, your main center where you can save a lot of money is what we call as supply chain management. There is a
Hmm.
huge waste of money in hospitals in not a digitalized solution for supply chain management, which can keep and use capability utilization
Right.
of OT beds, equipments, and so on. And last,
Hmm.
very, very important is, when you're talking in terms of generating doctors going forward, all of
Hmm.
us have years and decades of teaching capability. Let the
Hmm.
private doctors spare some time, and I will even go to the extent that it can be honorary. I don't think
Hmm.
any one of us at the present moment are now working for financial gain. Let us contribute few hours every week, many hours
Okay.
every week, to teach in the government hospitals. Let every private hospital become a small teaching unit. Let the private hospitals be a part and collaboration as a hub and scope model with the government
Okay.
hospitals. What we need to do is we need to increase the number of doctors. That's the crux. If you don't have adequate doctors, you can build buildings, you can build institutions. If you don't have your arteries and blood in it, which are the doctors, you will not have a long term sustainable and scalable product. You need doctors. To produce more doctors, you need more teachers. When teachers are readily available, it doesn't matter in which format they come from. The doctors
Absolutely.
are available, the teachers are
Yes,
there
sir.
to teach. Let the resources be more judiciously shared, so that in another 5 years, let's say, we have at least a 30 or 40% enhanced capacity of teachers, more doctors.
Okay, Mr. Gopal, will you like to respond to this idea of Dr. Bagai? I give you 30 seconds. I have very little time.
In fact, when we were pushing for the medical education reforms, we wanted each and every bed of the country, including private government, they should be used for medical teaching. That's the bottom line which we have been pushing for many years. And as a result, the DNB route, we are pushing the DNB route for at least having specialists. We would be having adequate doctors, but we require specialists to take care of the secondary and the tertiary care specialty. We are pushing for that.
Okay.
We want each and every bed in the country to be used for medical teaching.
Okay, Mr. Kumar, I would like to give you the last word, and you were talking about the use of AI, specifically the healthcare sector, and the kind of technology that will shape up the future of the healthcare in the country. I give you the last word on the panel.
Uh, Thank you, Hina. I think it's pretty clear that if you feel the building blocks of the digital health mission, it will actually bring in from one the layer of the infrastructure, and second, as what Dr. Bagai was compounding to in terms of the hub and spoke, and these secondary would be the data hubs, and these have to be colluded along with the transactional platforms, which are the hospital information systems, electronic health records, population health records, remotely connected data or the IoT devices. And if you look at what will happen is the unique power of AI will be to complement all this data collected by the different institutions, and actually
Hmm.
to actually amplify and complement human skills, which are not to significantly expand the scope, because that's what is going to aid the decision making and enable quick learning and save valuable time of a clinician. Having said that,
Hmm.
it's very important that this has to be governed by a proper layered protocol, and making sure that the information and the privacy is maintained. And that's how we see that the health information technology and the AI will bring in a large stream of big data streams, which will evolve and actually help in collaborative care management right across from the lowest level of the patient at the rural area to the secondary level. And to do this,
Okay.
it is essential that we scale the skill index and we need to build
Hmm.
the capacity not only from the physical caregiving, but
Hmm.
enabling the citizens and the doctors and the care providers using these health technologies to make
Okay.
meaningful generate meaningful data, which can be leveraged by the AI for complementing the decision making. That is going to be the way
Okay.
forward.
Okay. I think Dr. Bagai also wanted to make a quick point. Yes, sir, very quickly.
AI is my favorite baby. So AI is not a difficult word. Most people tend to use it very loosely without actually understanding it. Let me just
Exactly.
explain it in just a flat 1 minute. All smart TVs use AI. Facebook uses
Hmm.
AI. Twitter uses AI. We are going ahead well beyond AI now into behavioral AI. What is AI? AI is something which does a combination of smart thinking, rapid analysis, data accumulation, smart protocols through algorithms, and deep machine learning that in 30 to 40 seconds you can scan more than 2 million articles for a clinician and give you the best treatment protocol for, let's say, a male aged 50 with hypertension, with 1, 2, 3, 4 comorbidities, with these lab values and these behavioral habits. So what it does is it gives you that level of precision thinking without any wastage of time. What AI does is it gives you almost a 42% better clinical data. It gives you rapid diagnosis. It improves your diagnostic capability by 30%. It increases your bed utilization by 50%. And most critically, from 9.5% human errors as medical errors, AI decreases it to less than 1%. If we can save human lives, if we can eliminate human errors, medical errors, and give lives back to otherwise critically ill patients, that technology has to be fantastic.
Absolutely. I think you've
Absolutely.
summed it up quite well. Thank you very much, Dr. Bagai, Mr. Kumar, Mr. Madan Gopal, and Mr. Vaibhav Timari for joining us here on this very interesting panel
Thank
discussion.
you.
We can hope that the policy makers are watching as well and will surely take some ideas from here to reimagine the healthcare in our country, because coronavirus clearly has given us an opportunity. And with this Prime Minister's mantra of making India Atmanirbhar, can help us reimagine the healthcare sector in our country and make it better. Thank you very much, all of you, for joining us.
Thank you. Bless you.
Thank you.
Thank
Thank
you.
you. Thank
Thank
you.
you.
Okay.